Thank you very much, Matt. Appreciate it. Right, so let's get started. This is a whistle-stop tour of Piota and our platform and what we do, just to kind of give you a flavour of what we've been up to and what some of our clients have been up to. But what we have is an app platform. And before I get into it, I'll just talk a little bit about me and my experience. But my name's Chris. I've been in the industry for 20-odd years. Worked prior to working with Piota for 10 years within the NHS. So among my many different responsibilities was the internet and the intranet. I created sort of online learning content for my colleagues, created a number of different apps within the hospital. So been around the block a little bit, worn the t-shirt out. But I'm really interested, and so is Piota, really interested in what's the heart of what we do is making digital life easy for people, especially patients, families, carers, but as well sort of your colleagues as well. Lots and lots of great apps out there. Everyone's using the smartphones these days, but I think what we're trying to do is just make it easy. Try and take out some of the complexity of using these different devices and using these different things. So it's all about quick and easy. It doesn't have to be sort of drawn out, long, complicated. Let's make it easy for people. Just a quick overview of our clients. We work with sort of NHS England, Public Health Wales. We've started working with our first ICB a couple of weeks back, but ICSs, cancer alliances, hospitals, down to individual teams. So the whole sort of spectrum of the NHS have got a Piota app. I think we've got between 120 and 130 apps out there at the moment within sort of health and social care. So our platform's been around for about 4 and a bit years now. So it's fairly robust, it's really well tested. As I say, we've got a plethora of clients that use the app for all sorts of different things. Our app it's a platform that we're licensing to use, and our clients are those that have identified that they want to jump onto the digital ladder. They want to provide their patients with a better experience. It's not just about patients. I think for a lot of our clients, they're looking at patients, families, carers, support bubbles, teachers, anybody really, within the social circle of the patient that would benefit from having information about conditions, about treatment, about services, about the networks and the different services within the community that are available to them. So these teams are very passionate about what they do, and rightly so. They want to improve the patient experience, or in some instances, for colleagues. But our apps all look the same. Top half of this app that I'm demonstrating now has a logo or an icon, and then below that we have the sort of menu system, which we call the tiles, but they have sort of icons and labels, and it's been designed to be easy, intuitive. You push the buttons, you get the information you want. You don't have to think about this too much. You can just pick it up and run with it. But as I say, we do lots of different apps for lots of different services. As you can see, they all look a little bit similar, but they're all based upon the individual requirements of these teams. So we do a hell of a lot of patient apps, but as I say, we're doing a lot more sort of staff apps as well now. So we're looking at how we can increase efficiency, improve better access to information, remove sort of digital exclusion. So lots of different organisations wanting to, or realising the benefit of apps, because let's be fair, we've all got phones these days. They're all on our persons, on a regular basis. I think we're looking at them, a little glance here, a little glance there, on average about 3.5 hours a day. So why wouldn't we want to utilise this new modern technology that everybody has on their persons? So what I want to do is talk about a couple of apps, patient apps specifically, and then I'll give you a quick overview of a staff app that we've produced, and just a little bit about the sort of story behind them. So it is about, for the most part, about empowering patients, providing them with the right information, trusted information that your team has kind of audited, collated, curated, and then been able to distribute. So, removing that sort of going on to Dr. Google and trying to find information, or for a lot of patients, is searching the trusted internet, looking for that information and searching for that information. And this modern day that we're in, where everyone's at 7 million miles an hour, if you don't find it relatively quickly, then the opportunity is perhaps gone. So providing something that's quick and easy for patients to be able to find the information, to learn about their condition, the treatment, the services that are available, it is invaluable for different teams. So let's have a look at this particular one. This one's from Morecambe Bay, and this one's for the maternity team there. And again, if we look at the app, top half of the screen is their sort of logo, their branding, the colour schemes. It kind of all fits into their, their corporate brand. And then below there, I want to say pathway, but it's, it's just a route through, pregnancy. And historically, this would have been given perhaps as a big, thick booklet to mum. But dad, grandparents, and others, probably wouldn't have access to that, so wouldn't be aware of the information that's available to them. But in this instance, it's about getting rid of all those books, getting rid of all that paper, getting up into the digital age, and providing parents, grandparents, and any others with information about the service and what's available. So right from the very beginning, all the information here, as I say, is curated. We license the platform. It's the team, the administrator within the maternity team there that updates the content and keeps it fresh and sort of alive. But this is all pregnancy referral forms. They have links to different videos, so you can do a quick tour around the maternity units. Again, all this can be done from the parents' own home. They don't have to come into the hospital to have a look anymore. Lots of information, relevant information about newborns and how they, how you should be looking after them. They've got a contact section here. And again, all of the departments or the different suites or the different individuals, you can go into the contact section, you press the call button, and you're ringing through to them. It's super quick and it's super easy, and that's what the team's looking to do. It's about making the process a lot more easy for parents to be able to provide them all this information, so they're aware. They can make better decisions. It's all in-house in one particular place. Because we're using phones, we can use mobile alerts and push notifications. And again, we see these with all our new apps these days, where you have a little glance at your phone and you can see something you've been updated recently, and you can click on it and it takes you there. So it's just a real good way of keeping in touch with your audiences. Something similar is an app that we put together in conjunction with the Macmillan Information Support Team at Chesterfield Royal Hospital. So same principle. This is their app and all of the information there that they would normally provide historically with leaflets, with bits of paper, with emails, all brought together in one place. A bit of a one-stop shop, a quick and easy to find, if you will. So the idea is obviously to share this with the patient, but more importantly, I think it's especially in this area with the support bubble, with the families, because a lot of the time it's it's that support, knowing the different events that are available, the different financial incentives, or not incentives, but support that's available. It's not necessarily just the patient; it's the carers and the support bubbles that need to be aware. So this app provides all that information, again, all curated by the team at Macmillan, and that picture there is historically with all those different leaflets on the back shelf there is what they would do. But instead of that now, it's about providing that we've got this app, and this is all the information you'll need is all there. You can find it as and when you need it. When you've got a minute, when you've got that moment of clarity, and you're thinking about something, it's there. It's quick and easy to access. So same sort of principle. All the information they'll kind of need. Information about body support, information about finances, so on and so forth. The apps come with Google Translate embedded into them now. So if English is not your first language, you can sort of select through. I think there's 120 languages. I think most languages are in there, and quickly translate the app's content into whatever language that might be. Similarly, they've got a contact section, so all the different teams, all the different units can be quickly found, and a call can be made quickly, or there's an email section if you need to email them. But it's all there quickly and easily. Now I've got a question, I'm scratching my head, I'm not searching around trying to find the phone number or having to look on the internet and try and find it. I can just turn to the app, get the information, and if you press the call button, it takes you straight through. It's super easy stuff. It's simple. And it's about teams being able to really empower patients, families and carers, and just make life really easy for them. And last but not least, how we're doing for time. Not doing too bad, in fact we're doing really well. This app is for we do lots of staff apps. I suppose that's the first thing to say. So we do operational apps, We do apps around sort of well-being. We do apps for teams that want to provide information to perhaps the teams that don't have access to computers. And we hear that a lot, and this sort of term, sort of digital exclusion, especially sort of in clinical areas where there are a lot of computers, but they are being used, for clinical reasons, as you kind of expect. But for colleagues, they don't necessarily have the time or the ability to access the internet to find out information about well-being or benefits or opportunities or training or all these different things. So, as part of the People's Promise where everyone should have the same opportunity, it's kind of going awry a little bit. Similarly, we work with teams that with estates and facilities teams, where you've got the likes of porters and security staff, which again, don't have direct access to a computer. And the organisations rely on, team leaders to cascade information down. So we're seeing more and more sort of teams wanting to use apps to be able to provide information to staff in various different ways. As I say, we're all using phones. We all have them on our persons, majority of the time. So why wouldn't you want to use them to, increase efficiency, or to, engage better, or to provide, the same opportunities for all your colleagues? But this particular app we're talking about is for an emergency department in the West Midlands, Dudley Group of hospitals. Obviously, the ED department very overwhelmed and continue to be overwhelmed. So the consultant there tasked with just seeing how we can save time, how we can see more patients, how we can meet our targets. And taking a step back and looking at the team and how it's kind of operating, noticed, because of the staff. I mean, his staff running there as permanent staff, your nurse practitioners, but a lot of locums, a lot of junior doctors, a lot of medical students who kind of helping out as well, that perhaps just aren't familiar with all of the policies and procedures and the way that Dudley Group do things. So noticed that people were leaving bays to go onto the computer to get information about guidelines or protocols or kind of policies. And just getting onto the internet is not that easy for some of these teams. Tapping someone on the shoulder, do you mind if I just stop you looking at x-rays or looking at those bloods or whatever it might be, so I can go on the internet? There's sometimes a delay from one person logging in to logging out. So I really wanted to really make that sort of information access a lot quicker and a lot slicker. So in this one, he took all of the guidelines, policies and procedures initially and put them all onto the phone. So any of these colleagues, these locums, permanent staff, GPs, medical students, junior doctors could download the app. With this app, they would need to register first. So not anybody can download this and start looking at protocols and different things, but they would register. And once they're registered, they had access to all the different policies and procedures. And within 2 or 3 clicks, literally within seconds, you could quickly find the policy or the procedure that you're after, access it, get up to speed with what you wanted to do, and kind of continue your conversation or, continue treating your patient. And all of this could be done bedside. All of this could be done, within seconds, and there's no kind of rushing off or trying to get onto an internet and, not wasting, but spending 5-6 minutes trying to get onto the internet before you could get that information. So just saving a little bit of time here and a little bit of time there, all mounted up over a period of time, and you're seeing extra patients all of a sudden. So just making information much more accessible. So this was all about operational guidelines, policies, procedures. Took it a sort of stage further. And put on things like the staff rota. Again, this would normally need to be accessed whilst you're in the workplace, but made it available so colleagues could access this, wherever they were, just to make their lives easier. Put things on like, there's a forms section within all our apps, and if you've used things like Smart Survey or Survey Monkey, it's that sort of tool where you can build forms, whether they be for surveys, whether it be operational forms, whether it be feedback forms, whether it be patient, friends and family type forms, where you can build these forms relatively quickly, distribute them via the app, and then gather all the information to do with whatever you'd like to do. But in this context, annual leave request forms, handover sheets, booking forms, all the information again that you would probably need to go onto the internet and to download it and then fill it in, all all done electronically, all put onto the app where, you know, his colleagues could access this wherever. So, you know, just a real quick and slick way of being able to gather this information. But as I said, you know, it's providing that access, making it all accessible to colleagues. Again, consultant directory, so all the different consultants, all the different teams, all the different community teams that you may need to contact within the ED department, all put into one place. You know, not trying to search around for that coffee-stained bit of paper that's stapled next to the computer to try and find the number for X, Y, or Z. It's all in there. You know, you just scroll through it, press the call button, and kind of off you go. Super easy stuff, just making them a little bit more efficient, making it easier for them, giving them more time to look after patients rather than, you know, the admin aspect of their role. Went a stage further, trust mandatory training, you know, put the training on there. And again, I think this consultant, you know, his initial vision was to save time, to increase efficiency. But as, you know, as he went through this, it was all about making his colleagues' lives easier, both, you know, in terms of work, but in terms of training, but in terms of then, you know, putting wellbeing information on there. So yeah, just really providing a real easy access, and really easy resource to access. Different information there about colleges, and again, push notifications. So, you know, different things, lamp testing for staff, Wi-Fi downtime, blood gas results, all the sorts of information that you need to provide to your colleagues on a quick and easy fashion. You know, if you have this in your pocket, you feel a little vibration, or the next time you glance at it, there'd be a little alert or a little notification, and you would see that, you know, update a lot easier, a lot quicker than, you know, sending emails out. And I mean, all know, you know, you look in your inbox and it's absolutely full, and you're trying to find, you know, you're trying to find important stuff. Well, this was all very much focused, and then this is all operational information, right, straight to the phones, and it's just easy. Piota App solution. So what's it look like? How's it work? I'd say two aspects to it. You've got the app on the right-hand side, but on the left-hand side, we've got a content management system, which is super easy to use. If you use Word or if you use PowerPoint, you'll be expert in this in no time at all. And it just gives you the ability, it's cloud-based, one of your administrators yourself, to be able to come onto the content management system, to update some of the content and then distribute it, you know, instantly across to your phone. So super easy stuff, nothing complicated, really simple. This is a sort of typical page, so you can see there's a toolbar there, and yeah, you've got some formatting tools. You can insert different mediums, so links to websites, links to phone numbers, links to YouTube videos, links to other portals. Just super simple stuff. What does how do you get involved if you want to if you wanted to produce get an app going with us? There's normally an initial inquiry. We'll produce you a free trial. We've found from experience that, you know, we can produce you a trial, put some of your information in there, put some of your content in there, look at some of your challenges, be able to produce, you know, a proof of concept almost, which you can then take to your user groups, take to your leadership boards, take to your colleagues or your patients and show them and get a thought of how they're feeling and, you know, what their thoughts were. And we found that producing this trial is a real, you know, quick way of getting people involved and, you know, moving that conversation on. But once we've put the trial together, you've got the ability to demonstrate all that or your colleagues, and then it's just a matter of getting sort of raising POs and all that good stuff. What does this thing cost? Well, it's fairly low cost, low risk. It ranges from £2,500 per year to about £8,000–9,000 per year on a sliding scale, depending on how many users or how many downloads you're going to have during that period. So it's not mega expensive. It's good value for money, having worked with the NHS and trying to produce apps internally with teams and worked externally with traditional app developers. You know, it's not a massive amount of money at all. It can be really quick. I think, you know, not the best is not a race, but one of our clients once came to us at the start of the pandemic with an idea for their care home staff. And again, historically, all sort of communication was done via the care home manager and through team leaders. But obviously during the pandemic, the organisation wanted much more control about who was seeing what information they were distributing. So came to us at the start of the day with a need, with a requirement. And by the end of the day, we kind of rolled it out. They were emailing their managers and some of their staff to download the app. This is how we're going to be working with you. So we got it all done within the same day. So I say it's not a race, but by the same token, it doesn't have to be a long drawn out process. The people we work with have identified there's a digital hole in their offering. They want to improve patient experience. They want to provide better communications and engagement with families and carers, and they see that a phone app can do that. We've got a platform that allows them to do that really, really quickly. So I think that was my phone telling me 20 minutes is up, so we're just slightly over. So I'm happy to take any questions, but please do reach out to us. If you've got a thought of an app that you might want to do, give us a shout, and we can tell you whether we can, the requirements that you've got meet the platform that we've got, and then show you, different examples of teams like yours doing something similar. And then again, is that trial, if that's the way you want to go. So thank you all for your time. Appreciate that.
Thank you, Chris, as always. So everybody, I'm just going to launch the poll. So as mentioned there by Chris, if you would like to get in touch and have a discussion about how you might be able to get your app off the ground, please do get involved in the poll right now, and we'll follow these on to Chris. So Chris, starting with a quick question here. So how well utilised are they by staff organisation who have implemented them?
They're all slightly different, but a lot of our organisations we work with have found this to be a big success. It depends. All these things, it's always going to depend on your on the way you communicate. I'm still here.
Yeah,
sorry, it all depends on the organisation, but with most of them, they've been received really, really well.
Fabulous. Is the Piota app more of an information providing app rather than data gathering app?
Bit of both. So the majority of it is one way. We're providing information. We've got the forms and surveys where we can gather information, and as we continue to progress and develop as an organisation, our roadmap is about being able to produce more personalised care, and that will be then the integration of data from the app, and then being able to feed that back into into relevant systems, whatever they may look like. So whilst we don't do that integration today, it is on our roadmap, and it is something that's coming very soon.
Perfect. Thank you for that. Question for Chris: do you have any data to show how the staff app has improved engagement or well-being?
We don't obviously collect that because it's our clients that are using our platform to be able to do that. But I can certainly put you in contact if people are interested with people that are using the app, so you can have that conversation directly with organisations. But what I would say is that we don't hear any bad news. We don't people saying this has been detrimental to our service, or our patients haven't liked this. It's the exact opposite. People love it, the clients love it, and the patients think it's brilliant. So I don't have any firm data that I can publish with you, but as I say, if you've got a particular challenge, a particular area, then it's likely that we've worked with somebody else in your particular area, and then we can share contact details so you can speak with those people directly.
Perfect. I would just advise delegates, if you didn't get involved in the poll, go to handouts PDF and click on Piota and arrange a meeting from there, and we can get them that data kind of sent across from that side. So here's one for you, Chris. So looks really interesting. Our patients are mainly over 65 or are moderately severe, frail. Have you had any success with apps for this cohort?
Yeah. I mean, there are apps that will be out there. Undoubtedly, we hear this quite a lot about over 65s. I'm 50 odd now or something. But I think perhaps pre-COVID, there may have been a concern about people's experience and confidence using technology. There's not been many benefits of the pandemic, but I think one of those benefits would be it's forced people to use their technologies much more. So I always take my mum as an example. She before she had a phone, because it's the thing to do, didn't know how to use it. Was using other functionality, but because of the pandemic, she started to FaceTime. She got a little bit more confident. She started to do her shopping. she got a bit more confidence. So I think the over 65s conversation, is perhaps not as prevalent as it once was.
Yeah, I would agree with that. I would agree. Well, Chris, that leads us up perfectly to the end of the presentation. So thank you as always for getting involved, and hopefully we'll see you soon.
Cheers, Matt. Thank you very much. Have a good afternoon, guys. Thank you.
Bye now.